Welcome to Real World, Real Talk with Dr. D.Z. Cofield. The show represents captivating conversations and insightful information to encourage and inspire you with all you need to become the best you can possibly be. And now, your host for Real World, Real Talk, Dr. D.Z. Cofield.
Welcome to Real World, Real Talk. I'm your host, Dr. D.Z. Cofield, and you're listening to your member-supported public radio station, your number one source for jazz and more, KTSU 90.9 on the FM dial, ktsuradio.com, and on the Real World, Real Talk podcast network. I want to thank you for being with us on today for what promises to be a very, very important show. As a matter of fact, it's so important. It literally is a life or death show, and you'll understand it in just a moment. First of all, let me take care of a couple of housekeeping matters. If you'd like to follow me during the week, you can follow me on Instagram, on IG at DZ Cofield. You can follow me on Facebook at DZ Cofield, and you can follow me on Twitter at, you guessed it, DZ Cofield. Listen, the vaccine now is open to all adults here in the state of Texas. So everybody, if you want to get the vaccine, you can get it. And I want to encourage you to do that, whether it is the Pfizer vaccine, the Moderna vaccine, Johnson & Johnson, for those of you who may only want to get one vaccine. Listen, make sure you do your part, not just for your own health, but for the health and wellness of your family members as well. So I want to encourage you to make sure you go and get the vaccine. All right. Make sure you do that. Now, you know, I've heard some people say, well, I don't want to get the vaccine. I got some questions about it. Where it was developed, how it was developed. Listen to me very carefully. Well over 500,000 people have died without the vaccine. My question is, how many people have died from it? Not even close, right? So I'd rather be with the vaccine than without the vaccine. I've gotten both of mine. My wife has gotten both of hers, and I want to encourage you to make sure you get both of your vaccines. And if you're getting Johnson & Johnson vaccine, that you get the one vaccine and you get it as soon as possible. Don't worry about the side effects. The greater your immune system, the less the side effects. But if you have really hard side effects, that means you probably would have been adversely affected by COVID-19 if you caught it, and people are still contracting the virus all over the world. So make sure you do your part to stay healthy and safe. Today, I want to talk about sleep. I want to talk about sleep and the importance of rest. The fact of the matter is, most people who are listening right now, you probably don't know how much sleep you need. And you're probably in the midst of COVID and the economic crisis and racial injustice and all of the other things that are going on. You're probably not getting as much sleep as you need. I was just watching television the other day, and they were talking about the importance of sleep. And they said driving without sleep is like driving while intoxicated. Your motor skills are inhibited. Your cognitive skills are diminished, simply because you didn't get enough sleep. I am excited to have a specialist with us on today to help you get some rest. For those of you who have been waking up early in the morning or had trouble getting to sleep and you're just tired and lethargic, it's more than just losing an hour's sleep when we went into daylight savings time. Most of you weren't getting enough rest before that. I'm happy to have with me today Dr. Annise Wilson. Dr. Annise Wilson is a native Houstonian and graduated from the University of Houston. She obtained her medical degree at UT Houston McGovern Medical School. She then went on to pursue her residency in neurology at Northwestern University and stayed to complete a sleep fellowship. She is currently an assistant professor at Baylor College of Medicine, where she sees both general neurology and sleep medicine patients. Her special interests include sleep disorders during pregnancy and addressing health disparities. Listen, join me in welcoming to Real World, Real Talk, Dr. Annise Wilson. Dr. Wilson, how are you doing?
Doing well. Happy to be here.
Man, I am so excited to have you with us on today. And one of the reasons is because, one of the things whenever I go to my cardiologist, he asks me, am I drinking enough water? Am I eating right? Am I getting some exercise? And then he says, are you sleeping? And, and I used to always say, Doc, why are you worried about how much I'm sleeping? And he started telling me about the importance of sleep to my health. So just give us a general overview of why sleep is important, because I've heard people jokingly say, sleep is overrated and, you're going to sleep away a third of your life. And they really downplay the importance of sleep. Why is sleep and rest so important?
So sleep is critical to how we all function. So, in terms of your ability to remember things, your ability to be attentive to things, including, minimizing risk of car accidents, which is what you had alluded to before, your overall health in terms of your immunity, especially at a time like this, in terms of weight management as well. So those who are chronically sleep deprived tend to gain weight, overall mood as well. And then even when it comes to healing and repair, which is what your cardiologist was also alluding to, is definitely also affected by a lack of sleep.
So I've got to ask you, because I was watching the news and they were talking about how much our sleep has been interrupted by stress and anxiety around what's going on in our society. COVID-19, economic crisis, racial and social injustice. I mean, you can just go down the list of what people are dealing with, not to mention just everyday struggles and everyday issues. Right. And when we talked about that off camera, you said the truth of the matter is people weren't getting enough sleep before COVID-19. And right. What has happened over the last year has just exacerbated that.
Exactly.
Would you give our audience some insight into what you're referring to when you say that?
Correct. So prior to the pandemic, the vast majority of Americans were not obtaining sufficient amounts of sleep. So the recommendation is about 7 to 9 hours. Now, sleep is on a bell curve, and so not everyone actually needs 7 hours, but most of us do. And the same thing, there are some people who require slightly more than 9 hours, and that's still considered normal unless it's causing additional daytime dysfunction. But prior to the pandemic, about 75% of Americans actually were not even achieving that. Now, the goalpost changes a little bit based on age. So teenagers need more sleep than adults. Younger children need more sleep, and then babies need the most sleep. But the concern is that with the pandemic, due to the factors that you had mentioned before, it's now worsened. And so now with stress and then with illness, grief, now people are sleeping even less than before. And their overall sleep schedules have also been affected, which is causing additional health effects down the road.
So we're hearing people talk about the lingering effects of having COVID-19. We know we're well over 500,000 people who have died as a result of COVID-19, but we have not had any real in-depth conversations about the number of people who have been affected by it, brain fog, lingering fatigue, and those kinds of things. Can you talk about sleep? Because you talked about the relationship between sleep and our immunity. So let's talk about that a little bit, because I think a lot of people may miss the fact that sleep is really an integral part to the recovery of their body, the strengthening of their body, and to make sure their body is as healthy as possible.
Correct. So when it comes to the immune system and sleep, so with more sleep, now you're allowing your body to recover. And so you're allowing the natural healing process to occur. And so with that lack of sleep, especially related to COVID, now there's a lot of unknown, just given how novel the disease is. But when it comes to the dysfunction in terms of the brain fog and other factors, the concern is that with increased amounts of sleep, some of that should subside with time. Now, there are a lot of post-COVID clinics, one of which is being developed at Baylor to specifically address that issue, given that there is not a lot that's known about that. And the hope is that going forward, there should be actual treatment plans to address this.
Why has this pandemic affected our sleep so much?
So the main reason is because of you know, a lot of people are now working from home. And so with that loss of structure, which would be waking up at a specific time, going to work, you know, coming home and, you know, picking up the kids, you know, making dinner at a specific time, going to bed at a specific time, a lot of that's been lost. And so that loss of structure, as well as the increased electronic use, which leads to increased light exposure at later hours of the day, which can then affect your melatonin. And the melatonin affects your sleep onset time. And so with all of those factors, that has led to a kind of a disruption of the normal body clock rhythm or the circadian rhythm. And that's what's leading to a lack of sleep.
If you're just tuning in, you're listening to Real World, Real Talk. I'm your host, Dr. DZ Cofield, and I'm in the studio with Dr. Annise Wilson, and we're talking about sleep disorders, the importance of getting your sleep, getting your rest, and if you're not, what you need to do to try to reverse that trend. Let's talk about some common sleep disorders. I was not aware before getting ready for this show how many sleep disorders there are out there. And normally, you know, when you have a bad night's sleep or maybe a couple of days sleep, you know, I remember when I would sleep, you know, of course, you know, you had a nightmare or something, you know, my grandmother said, you know, okay, what'd you eat last night? You know, but I didn't know that there was a relationship between what you eat and how you sleep. So let's talk about common sleep disorders.
Yes. So common sleep disorders, especially right now, insomnia is extremely common. Another one is a disruption in the body clock, which is what we call circadian disorders. And that can either be that your body clock runs late, which is what we call night owls, or the morning larks, where your body clock runs very, very early. Or there are some other circadian disorders as well, but those are less common. Sleep apnea is one that is quite prevalent, but is undertreated and underdiagnosed. But it has significant health effects, some of which include things like heart attacks and strokes.
So can you define for us what insomnia is? Because it's funny, I called a friend of mine just the other day, and it was probably about 9 o'clock or so. And I typically am shutting down before then, but I needed to talk to him about something pretty important. And I apologized to him. I said, man, I hope I'm not interrupting your rest. And he said, man, look, I've been dealing with insomnia. So you probably could have called me 4 hours from now. I still would have been up. And I was kind of surprised. And I've heard of people that I've known, some very famous people, very scholarly people who suffer from insomnia. What is insomnia?
So there are different types of insomnia. So there are certain types. So there's kind of a more acute insomnia, which is commonly seen during stressful events such as, let's say, like the pandemic. And then there's more chronic insomnias that have been lingering for a long time. And of course, an acute on chronic insomnia. But that would be just the inability to either fall asleep or stay asleep, or stay asleep, which is causing significant daytime dysfunction.
Now, you mentioned sleep apnea, and I didn't know anything about sleep apnea until, of course, I started going to my cardiologist, and, you know, he started asking me questions. And so then he, you know, prescribed a sleep study. And then, you know, he told me I had sleep apnea and I need to get a CPAP machine and, you know, and all this stuff. And I'm going, whoa. But I was really shocked at what happens to the body and how deadly sleep apnea is. So can you share that with our audience? Because, you know, I hear of a lot of people, you know, in their 20s and 30s who are dying in their sleep and, you know, had a heart attack. And now I'm watching this and I'm going, oh man, I wonder, he probably had sleep apnea, or she probably had sleep apnea. So can you talk about sleep apnea and why it's important to get that diagnosed? Because you said it was underdiagnosed, but it is very deadly.
Yes, it can be extremely, extremely dangerous. So sleep apnea is a disorder of what we call the upper airway, which would be the palate. So if we look, you know, if you opened your mouth and you look straight back, that would be the upper airway. And so when you fall asleep, your muscles relax, including your throat and your tongue muscles. But in sleep apnea, you have either a partial or a complete collapse of the upper airway, but that leads to a complete blockage. And that blockage then causes a drop in oxygen, which we can detect with the oxygen sensor, in addition to it disrupting your sleep. Because when that drop in oxygen occurs, your brain senses that drop, And it sends out a signal that tells your body, wake up, we're in a dangerous situation. And so then you wake up, you take a breath, and you fall back asleep. The problem, though, is that if this is occurring multiple times a night, not only are you experiencing disrupted sleep, but you're also putting stress on the body. Because when you have that drop in oxygen, you're releasing what we call cytokines or pro-inflammatory markers that can then increase your risk of abnormal heart rhythms like atrial fibrillation. It can cause an increased risk of heart attacks and strokes. It affects your overall insulin resistance, which can then lead to diabetes. It can cause higher blood pressure. It has effects on the brain and memory, and there might even be a correlation with dementia down the road. And so it just causes many, many issues. The other thing I want to comment on is that sleep apnea is not only a disease that's correlated with weight, it could also just be overall anatomy. So the common misconception is that people will say, oh, well, if someone gains weight, they're more likely to have sleep apnea, but you can be thin and still have sleep apnea if you have characteristics such as a very narrow, what we call a palate, or just like a very arched, narrow palate. If you have a larger tongue, wider neck, small jaw, all of those would make you predisposed to developing apnea. The other misconception is that they'll say, oh, only adults get this. But they're actually pediatric sleep specialists because there are many children who are actually diagnosed with sleep apnea. And so that then ties into, well, how do we screen individuals for sleep apnea? And so common things that you'll see would be things like snoring, a lot of daytime sleepiness. Some people have morning headaches. Some people have issues with like either blood pressure, heart issues. For women, sometimes even insomnia, surprisingly. And overall prevalence associated with gender. So men tend to have a higher rate of developing apnea as compared to women, and then the increased prevalence with age as well.
You said something that I found really interesting with the number of people, especially in the African-American community, that suffer from high blood pressure and diabetes. Did I hear you correctly when you said sleep apnea can cause your insulin levels to go up and your blood pressure to increase?
Well, it makes your body is less responsive to the insulin. Okay. And so then that can then lead to the development of diabetes. And the same thing goes in terms of blood pressure. There's been a strong correlation with untreated sleep apnea and high blood pressure as well, both of which can cause many, many additional health issues down the road too.
Wow. So how do I get diagnosed for it? I mean, because I know everybody who snores doesn't have sleep apnea.
Correct. Mm-hmm.
Some people who sleep quietly may have sleep apnea. So what are some signs? What do I need to do to say, hey, what do I need to be cognizant of so that when I think about my sleep and I think about my rest, I can say, you know what, maybe I need to go to a doctor, and who do I go to in order to say I'm having trouble with sleep and maybe I have sleep apnea?
Right. Excellent question. So things that we look for would be, snoring is definitely one. Has anyone ever heard you stop breathing while you were sleeping? Do you sometimes wake up gasping or choking? Any particular issues with daytime sleepiness? Are you so sluggish during the day you can't wait to get home and fall asleep? Are you waking up in the morning with headaches that go away without actually needing to take any medicine for it? Are you noticing any additional health issues such as abnormal heart rhythms like atrial fibrillation? Do you have a prior stroke history or a heart attack history, or at least coronary artery disease? Do you have a family history of sleep apnea? And also just age and gender, just given the prevalence with increased age and with the male gender. But again, women are typically underdiagnosed. And so one of the biggest pushes is to make sure that women are being questioned about this, because women may manifest some of these symptoms slightly differently.
It's very interesting that you say that, because, for example, if you have a family history, I don't know of anybody. I've been diagnosed with sleep apnea. I've never had a conversation with my children to say, hey, man, I have sleep apnea. They wouldn't even know I use a CPAP machine because they wouldn't come into my bedroom. My grown children wouldn't see it. Although my grandson came in the other day and asked what was that, machine by the side of the bed. But that's just one of those medical history, points that we really don't talk about a whole lot with our family members. So would I go to my primary care physician and just say, hey, I'm having trouble? And then would I have to get referred to somebody like you? How would that process go? I know it depends on the kind of insurance a person has, but typically what would be the steps?
Right. So the most common sequence of events is that someone is referred from either their primary care provider, their cardiologist, their neurologist, sometimes even psychiatry as well, because there is an association with an exacerbation of an ongoing mood disorder. Or some people just, they just present to the sleep clinic independently. And so what happens after that is that we go through the screening, which would just be a series of questions, some of which I alluded to earlier. And then we decide on whether or not we can either proceed with a home sleep test or an in-lab sleep test. And the way that we distinguish that is just by some associated sleep issues. So such as, there are a lot of people who might make a lot of movements while they're sleeping, or they have very severe cardiac disease, or they have other pulmonary issues such as COPD, and things like that would make us distinguish between, do we do a test at home or do we do it in a sleep lab?
How does sleep apnea affect pregnancy for women who are out there? Because you're talking about it being underdiagnosed in women.
Correct.
And I can imagine, women, somebody's listening right now who may be struggling with sleep, but thinking, I'm pregnant. It's just tied to my pregnancy. What is the relationship between sleep apnea and pregnancy?
Yes. So emerging data over about the past maybe 15, 20 years has shown that untreated sleep apnea during pregnancy can lead to a lot of pregnancy complications, and that's both for the mother as well as for the developing fetus, some of which would include things such as preterm delivery, low birth weight, intrauterine growth retardation, and even gestational diabetes and hypertension, which would be diabetes and hypertension, but it's specifically associated with pregnancy. But the problem there is that if we also include the poor morbidity and mortality, meaning poorer outcomes during pregnancy for both Black women and Latina women, and you add on the sleep apnea component, that's really detrimental.
Wow. What are some common mistakes that people make when they're not sleeping well? I hear all kinds of things that people do, saying they can't sleep without this, they need this on, they need to drink this, they need to take this. But if you were just starting with a blank slate, what are some common mistakes that people make before they go to bed that can keep them from sleeping like they should?
Yeah, so the most common mistake that people make is just very heavy electronic use right before bedtime. And we've seen even more of that during the pandemic just because of the loss of the normal structure, the normal daytime structure. And so, some people are like on their phone, in the middle of the night, or they're on their computer or watching television. But the issue is that bright light can actually affect your melatonin. So light can actually suppress your melatonin. And remember, melatonin actually promotes sleep onset. And so that's, so that doesn't quite work. The same thing goes for caffeine. Caffeine inhibits a chemical called adenosine, and that also can promote sleep as well. Just bright light exposure, a loss of a normal sleep schedule. So going to bed at one time on one night and then going to bed hours later on another night and just kind of zigzagging, that can also affect the overall sleep. The overall environment, is it very noisy where you're sleeping? Is it uncomfortable? Is it too hot? Some people need to meditate before bed, or they use like aromatherapy. Some people like to journal before bed. Just things to help wind down can also help promote sleep as well.
There seems to be a lot of movement towards, and I'm hearing people talk about white noise, playing rain, whatever the case is, and that's helping them to sleep. what's happening to the mind and the body when something like that is being used?
I mean, the main thing is just telling your mind that it's time to transition to rest. That's the main thing behind the white noise, and other sounds. And the same thing goes for aromatherapy, any other forms of meditation. It's just helping the body to unwind so that you're not going from such a stark contrast from being awake to going to sleep. And so just helping to ease that transition process.
I got you. So for somebody who is listening and, they're having trouble sleeping, they've been trying over the counter medicines. Maybe they've been trying melatonin and they've been taking, melatonin and things like that. Do those things help get you to sleep?
So some of them can, but the only issue is that one, you have to be very, very careful about, will this interact with anything else I'm taking? Now, typically with melatonin, it doesn't. But then even high doses of melatonin can sometimes cause side effects as well. But more so for your Z-coils and some of those other, Benadryls, you have to be very, very careful about those. But the issue is that if you're taking those and you're still struggling, that might be indicative of it being time to actually see a sleep specialist, because we do have methods that can help you wean off of those over-the-counter medications so that you're able to fall asleep in a natural way.
Well, I tell you what, once I was diagnosed with sleep apnea and I got accustomed to, using that CPAP machine, man, I wake up in the morning like, yes, ready to take on the world. Mm-hmm. I mean, the world looks completely different after a good night's sleep and some rest. Right. So, that's tremendous. What are some things that you would say to somebody who is having trouble sleeping right now? What are some steps? Is there a regimen that you can give them, kind of a 1, 2, 3, that may break them out of some destructive habits or activities that they're doing that they don't even know is really hurting their ability to sleep and their ability to rest?
Right. And so with these tips, this is going to be specifically for just pure insomnia, because if there's some underlying sleep disorder, then the underlying issue would have to be addressed, much like what you had just stated, is that, because you had underlying sleep apnea, treating it then led to an improvement in your overall sleep quality. And the same thing goes for any of the other sleep disorders. But for just a pure insomnia, especially one that has just started, then things that we recommend would be establishing a structured sleep schedule. So you wake up at this same time, you go to sleep at the same time, whether it's weekday or weekend. Getting bright light when you first wake up, and then avoiding bright light in the evening before you go to sleep. Avoiding caffeine.
Doc, let me stop you right there. So why is bright light important when you first wake up?
So the main thing is just to promote the wakefulness. And the same thing goes in the evening, because the bright light can affect your melatonin. Is also to help promote sleep by avoiding bright light. Okay,
got you. Mm-hmm. You were going to caffeine usage.
Yes, so avoiding caffeine in the mid-late afternoon and early evening, because again, it does affect the adenosine level, which can then also affect which can then make it harder to fall asleep. And the same thing goes for alcohol. So surprisingly, even though the common thought is that alcohol helps promote sleep, it actually disrupts sleep. And so it'll actually cause you to wake up more often in the middle of the night, even though it seems like you're falling asleep faster. So avoiding alcohol in the hours prior to going to sleep as well. And then optimizing your sleep environment. So that would be, minimizing the noise. And when I mean minimizing noise, so the ambient sounds like the white noise and waterfalls, that's fine. But I mean just like a lot of environmental noise, so like neighbors or other things, minimizing that. The temperature, so is it too hot, is it just too uncomfortable? Bedding is always important. And then minimizing electronic usage, because again, the bright light is detrimental to sleep. Some people like to exercise as well. Meditation is always recommended. And then for those who have issues with just a lot on their mind, where they're like, I lay down and I just have so many things going on in my mind that I can't rest. a lot of times we recommend journaling, or at least getting your thoughts down on paper before you go to bed, so that we can at least try to transfer a lot of those thoughts onto paper.
So for the person who says, I have trouble sleeping, I'm kind of thinking back to when I was a kid, and, my mother would say, hey, you need to go to bed. And it typically would be on a weekend. And, she would say, well, yeah, you need to go to bed. And I'll be like, oh, I'm not sleepy. I'm not sleepy. Well, just go lay down. Just go lay down. And inevitably, of course, when I go lay down, I fall asleep. What is the relationship between just stopping and just resting? Because I hear what you're saying, for example, with electronic usage, and you're watching TV, you're playing a game, you're checking emails, whatever it is, and then you shut all of that off, you turn the light off, and then you wonder why an hour later you're having trouble going to sleep.
Exactly.
What is the relationship between just resting? Is there a prescribed period where you say, you know what, shut off the electronics an hour before you want to go to sleep?
Yeah, that's actually usually a recommendation. Yeah, about like an hour, about an hour or two before you go to sleep is the general consensus about, how much is too much. Because we're not trying to make anybody miserable in terms of being like, turn off right now, but it is to help promote sleep.
Yeah. Can you talk about the different levels of sleep? Because, all sleep is not created equal, right? So sometimes people think they're sleeping, but they're really not getting to that really good sleep, we we jokingly call it that good, slobber out the side of your mouth sleep, where you just really just knocked out. Are there different levels of sleep, and do they provide different amounts of rest?
Yeah, so we do have multiple stages of sleep, and so that would be, so we start with the wakefulness state. And then you transition into your different stages. Now, you may transition depending on what's going on. So, for example, if you're chronically sleep deprived, you may enter your REM sleep earlier than expected. But typically, you would fall into what we call N1 or stage 1 sleep, and then you would transition into stage 2, and then stage 3, and then REM, and then you just cycle through that multiple times per night, with the longest REM period being in the early morning hours. In most cases. And so in terms of how much time you spend in each stage of sleep, for someone who doesn't have any existing sleep disorders, it would be approximately about 5%, about 5% stage 1, about 45% stage 2, and about 25% stage 3, and approximately 25% stage REM in normal cases. Now, the only thing is that if there are things that are disrupting your sleep, so let's say untreated sleep apnea, or let's say, insomnia, or let's say just normal pregnancy changes that disrupt sleep, then your staging will also be slightly different than what I previously mentioned. And the same thing goes with age. So, the older you get, the more likely you're going to, your stages are going to be a bit more fragmented, and that's just normal. That's normal aging. Although there could be other sleep disorders associated with that as well.
I want to go back to a point that you made earlier. You talked about children, infants, teenagers needing more sleep than adults. And, I could hear a parent hollering at their child to get up, and they're lazy, and, hey, you need to get moving, and you're saying that infants, children, teenagers need more sleep, not less sleep. And I remember as a teenager, the greatest thrill in life was being able to stay up all night long, right?
Right.
I get to stay up all night long. We would brag about that to our friends, Why is sleep so important for infants, for children, and for teenagers?
So the main thing is at least what we know, because we don't fully understand sleep, but from what we know, just in terms of overall cognitive development, and just in terms of immunity, like we talked about, mood, healing and repair, weight management, all of those are critical. And in terms of teenagers specifically, so teenagers require approximately about 8 to 10 hours of sleep per night. Now, the only difference with teenagers is that their sleep tends to drift a little bit later. And so that's why a lot of teens will say, oh, I'm not tired at the normal hour that everyone else is, but yet it's so hard to wake them up in the morning. And so because of that issue, there's actually been a strong push by several of the sleep associations to make the school start time later for teenagers to accommodate that normal change in their body clock rhythm.
Really?
Now for younger,
Wow.
yeah, so that's why they tend to start, instead of it being like 8 or like 7:30, 8 o'clock, it's more like 8:30 to 9. Now, not all schools are doing this, but there has been an active push to try to make the start times later because of the fact that their normal body clock runs later than everyone else. Now, it normalizes when they become an adult, but during those teen years, they just tend to run late.
Wow.
They're more night owls. Mm-hmm.
Yeah. It's interesting you say that because I'm working with a group now. We're doing a youth intervention program. And I was telling them when I was a juvenile probation officer, my biggest challenge was to get my kids to their programs by 8 o'clock, 9 o'clock in the morning. And
right.
It was because they were staying up late at night, etc. And I was like, well, why don't we start the day a little later? And they would say, well, no, you don't do that because you got to get them accustomed to being in the real world and you got to make them become disciplined and all this. I'm like, but not awake. And when he's coming to school, if you get him here at 7, he's sleeping in like the first 3 classes. It's like, you think we can shift this? And what you're saying is that's natural for teens because their clocks are literally different.
Yeah, their clocks run late. Or what we call the delayed sleep phase. They tend to run late. And again, it does normalize. It's just that during those years, it really isn't their fault.
Yeah.
It really isn't their fault.
Wow. Can you talk a little bit about how your circadian rhythm is thrown off when you work, for example, swing shifts and you're working, sometimes in the day, sometimes you're working in the afternoon, sometimes you're working the 3rd shift overnight. I always jokingly say, that you don't become a real man or a real woman until you have to work the graveyard shift. That's just, it's brutal on you physically, emotionally. And I really want to not just affirm somebody who is in that position, but I also want to let their family members know, hey, here are some things that happens when you have to work and that swing shift is really tough on you physically.
It is. It's definitely tough because remember, if you have your normal body clock, and so for most people, let's say, normally you go to bed, let's say like anywhere between about 9 and midnight. But if you're doing these shifts, now your day and night cycle are completely reversed. But the problem with that is that now you're expecting people to just fall asleep prior to the start of the shift, stay awake during the time that they would normally be sleeping, and then fall asleep the following day. And then you have to incorporate things like bright light, noise because everyone else is up, things like that as well. And so it makes it very, very challenging. And the other thing is that they tend to get less sleep overall. But the problem with less sleep is what we had previously discussed. So, overall weight management. So they tend to gain more weight. And that's for multiple factors, including some of the hormones that are released on a day to night cycle. And it just also risk of illnesses and an overall productivity. It even affects the overall family life as well, just because now we're running on completely opposite sides of the spectrum. And so shift work is actually very, very challenging. And so a lot of times what we usually recommend is actually seeing a professional just to discuss, is there any way to optimize that? Well, one, if for those who have an option of working the swing shift versus a regular shift, is there a way to limit those shifts? And if there isn't a way, then trying to optimize it so that you're as productive as possible, but you're also getting as much sleep as possible.
Yeah, I know for me, it was, I'll be honest with you, I almost dreaded my days off because, I'd get back into a groove about that second day. And then it's like, okay, almost felt like the needle being snatched off the record. Let's get back that other schedule. And it was like, man, I don't know. I just felt like it was like demons from hell, man. And I worked it 7 years and man, it never got easy.
No, it's hard because you're working against your normal body clock. Yeah. That's the main issue, is that you're working against your body clock. And so a lot of times actually what we recommend is that on the days off, is to actually not completely split back to your normal schedule, but to do either to stick to that same schedule, which most people don't do, or do kind of a hybrid so that you're not completely shifting in one way or the other, so that you can transition back to that night shift schedule when you have to go back to work.
If you're just tuning in, you're listening to Real World, Real Talk. I'm your host, Dr. DZ Cofield, and I have with me in the virtual studio, Dr. Annise Wilson. She is a neurologist and sleep specialist. And no, she's not a specialist in sleeping. She's a specialist in helping you figure out how to get your rest. Dr. Wilson, as we get ready to close the last third of our show, can you talk to our audience about not just the importance of sleep, but what they can do to better manage their sleep? I think a lot of people see sleep and it's something that hopefully they can get enough of and they can feel good enough as they go through their day. But I'm not sure everybody recognizes the need to guard their sleep and to really fight for their sleep, to schedule their sleep. So can you talk to the audience about some things that they can do to really guard their sleep and why that's so important?
Yeah, I mean, the main thing is just establishing an off time. So because a lot of people are working from home nowadays, the main thing is establishing, okay, I'm going to stop working at this particular time, and then after that, then I'm done with work for the day. So that you have a clear off time, you're reestablishing a schedule, and then you now have time to dedicate to not only just personal life, but then also to sleep. And the same thing with waking up. That you wake up, that you don't just lay in bed doing nothing. That you just get up, you start your day, and you continue until the next end time. And the reason being is that when it comes to a lack of sleep, there's been a lot of data showing deleterious effects, including overall memory. And so the question is there an association between sleep deprivation and chronic sleep deprivation and dementia, which there likely is. Just overall cardiovascular health as well. Weight, which can then cause additional health effects down the road. Immunity. So those who are chronically sleep deprived tend to be more susceptible to illness. And an overall mood. So just helping to manage conditions like depression and anxiety as well can be improved with increased amounts of sleep. And so just given that, it's so important to actually dedicate a sufficient amount of time to sleep. And so in most cases, that would be approximately 7 to 9 hours for adults per night.
I've got to put a quarter in the meter and park right there for a second, because, we are dealing with so much grief, so much anxiety. And I think what I've come to understand is that, while we can talk about a cycle of grief, because we're grieving in multiple areas of our life at the same time, it's almost like we're going through the grief cycle in different stages at different places for different reasons in our life. So I may be in the depression stage over COVID-19, but I can be in the anger stage, because of my finances, but I can be in a denial stage because of the death of a loved one, etc. I want you to talk about that relationship between sleep, or the lack thereof, and my mood, because I think there are a lot of people who are not resting and then maybe wondering why, or maybe their family members or friends are wondering why they're very snappy. They seem very irritated, easily agitated. So can you talk about that relationship and how we can really help combat those kinds of emotional outbursts?
Now with that, so now there's going to be a lot of caveats here, specifically in terms of that sleep is only one component of managing mood disorders. And so in certain situations, it may be that there needs to be additional intervention by way of either a therapist, like a licensed therapist, or clergy, or even a psychiatrist. But if we're just going to focus on just sleep, it can actually manifest in different ways. So for example, with depression, some people will stay in bed all day, they just sleep all day long. But then you also see some people with depression who don't sleep at all. And the same thing goes with anxiety. You might see both manifestations of sleep disorders in different mood disorders. And so in terms of management, Depending on the situation, some people actually may require a prescribed medication, depending on the situation. Some people may be able to manage it through what we call cognitive behavioral therapy, which would be a sleep psychologist going through the specific issues that you're experiencing and coming up with a treatment plan for more of a behavioral intervention. And then for others, it may be a short lasting phenomenon where it improves spontaneously over time. And so it just really depends on which particular category you're in that would then determine the outcome. But the bottom line is that there are treatment options for everyone when it comes to the various mood disorders and how they're affecting sleep.
So, Dr. Wilson, that's why you're the doctor, right? Because you just pointed out that, especially when we talk about mental health challenges and other issues, that you always want to go to a doctor. You always want to see a physician. You always want to make sure that you're under those guidance. But I think you would agree that if a person is sleep deprived, it can exasperate whatever's going on in their life.
Exactly.
If they're emotional challenges, worry, anxiety, the less sleep you get, the worse the world looks. And I've just learned from me personally, however bad things look the night before, things just look a whole lot better after getting some rest and getting
exactly. No, that's why a lot of people say, when it comes to big decisions or, just anything, they'll say, let me sleep on it. They always say, let me sleep on it. I'll get back to you tomorrow.
Yeah. Uh-huh. No, absolutely. That's, yeah, man, I didn't even think about that one. Wow. Yeah, you're absolutely right.
Mm-hmm. It's true. Yeah, they had a point.
Yeah. What are some things that you'd like to say to our audience as we get ready to close out our show today, just about sleep? I guess one of the things I want to say to our audience is, and maybe get you to comment on it, if they're struggling in the midst of everything that's going on to rest and to sleep, that's normal.
That is very, very normal.
Struggling with that.
Mm-hmm. Yeah, so that it's incredibly normal. I mean, with the past year that we've had, everyone has been impacted in one way or another. And so it is okay that your sleep is disrupted. The concern, though, is that if it's getting to a point where you're experiencing either interpersonal conflicts, you're experiencing, job conflicts, or just significant day-to-day dysfunction, it is okay to seek help from a sleep specialist, because we are here to assist. Our goal is just that we restore your natural sleep rhythm so that you then feel refreshed when you wake up and that you go back to being as productive as you once were. Yeah.
How can somebody get in touch with you or your office? They're sitting there saying, wow, I think she just hit the nail on the head in terms of my own personal problem and struggles with sleep, with rest, mm-hmm. With me being agitated, angry, frustrated, etc. How can somebody get in touch with you?
So I am on the Baylor College of Medicine website. You can just look under Dr. Annise Wilson, or you could just look up the sleep clinic at Baylor, and our contact information is there, and we are definitely accepting new patients. And like I mentioned before, we do have a sleep psychologist as well, Dr. Nowakowski, who does offer cognitive behavioral therapy for insomnia. And so, for any particular sleep need, whether it is insomnia, narcolepsy, sleep apnea, the circadian disorders, which again is the body clock dysfunction, we are here for you.
Well, I want to thank you for being with us on Real World Real Talk. I don't know of anybody who would not have benefited from hearing this show on tonight as they think about just getting rest and allowing the body and the mind to recuperate and recover and be able to start the next day as fresh as possible. So, Dr. Wilson, I want to thank you so much for being with us on today.
Thank you. Thank you for having me.
The late Vernon John said, if you see a good fight, get in it. And if you don't see a good fight, start one. And I always say the fight for your health is the fight that you want to fight, and you want to fight well. And the fight for your sleep. We talk about eating right. We talk about exercising. We talk about, making sure your water intake is up and your sugar intake is down, and, diet sodas are bad and water is good. But sleep, something that simple. Man, the doctor said it so well. Somebody asks you a question, come to you with a problem, you think about it, maybe you meditate on it, and you say, let me sleep on it. Because that next morning, you have a whole different perspective. Your mind is clear. Your mind is refreshed. And I do my best thinking early in the morning. I know for me personally, sometimes depending on what time I go to bed at night, I may get up at 2, 3 o'clock. If I had a long day, a hard day, and I go to bed about 9, I need about 5.5, 6 hours of sleep. And then I'm like refreshed and ready to go. So I'm on that end of the spectrum. But I get some of my best work done at 3, 4 o'clock in the morning. Wide awake. It's quiet in the house. I don't have any disturbances. And man, I can just crank out some stuff early in the morning. Conversely, when I'm ready to shut down at night, I'm ready to shut down, right? But that's my sleep pattern. I understand what works for me. I want you to take the time to learn what works for you. And if you think you're suffering from a sleep disorder, especially sleep apnea, man, please don't play with that. Especially if you have diabetes, high blood pressure, congestive heart problems, and the like. It's believed that there are many people who are dying in their sleep of heart attacks because of undiagnosed sleep apnea. So please make sure you take sleep seriously. This is Dr. DZ Cofield for Real World, Real Talk, signing off. Get ready for Truth with V. Michael McKay, David Goldstein, Asia. They have the best of music and conversation coming at you next. Until next time, God bless you is my prayer.
Thanks for listening to this episode of Real World, Real Talk. Be sure to subscribe to this podcast to be notified of new episodes every week. Follow us via social media using the @RWRTDZ username on all platforms: YouTube, Facebook, Instagram, and Twitter. To submit any comments, questions, sponsor opportunities, or future show suggestions, visit us online at rwrtdz.com or via email at info@rwrtdz.com. Thank you for listening, and we hope you've been inspired to be the change you want to see in the world today. Until next time, be real, keep it real, and stay real.